So I think I'll start with, just overall the definition of metastatic breast cancer, which I think everybody knows. It's breast cancer that's spread from the primary site, being the breast, to other sites of the body, not the lymph nodes, and that's called regional disease, but we're talking about disease that's spread to other parts of the body, such as the liver, the lungs, bone being the most common sites. I think as a reminder, there are so many multiple types of breast cancer. I think that's a really important thing for people to kind of learn and take home. So some are hormone receptor positive, and these are stimulated to grow by estrogen. And, we treat these with anti-estrogen medicines and combine them with other medications to better treat the cancers. And then other breast cancers are hormone positive, and these are often more aggressive forms of breast cancer, but because they have the extra copy of HER2, they often respond to treatments that block HER2. In terms of treatment, I think the most important thing for me as a provider and a nurse is that the hope and purpose of treatment in the metastatic setting is to control the disease and to lessen the impact of symptoms, or both for patients. Most of these patients get diagnosed with symptoms. For example, they'll complain of bone pain, which is very different than joint pain, but, they'll complain of pain, in the hips or the ribs or the back. And cancer cells like to go to where the bone marrow is, and those are usually those places that people complain of pain. If it's, in the liver, people will present with sometimes jaundice if it's very late in the game, or pain in their, upper quadrant. So I think those are, important. I will say that things in breast cancer are evolving really quickly, and it makes it hard sometimes to keep up with all these updates. So one thing I think is really important is how we're using biomarkers to select agents for patients. So we're moving as a whole to a more personalized care plan for individuals, and understanding like what types of targets are present in a patient can help us tailor therapy better for our patients and allow us to improve outcomes overall, but also lowering toxicity while we do that. And I think the great news is patients with metastatic breast cancer are living longer. So minimizing side effects and maintaining their quality of life is very, very important, not just for the patient, but for the provider too. It's something it's always in the back of my mind. Treatment is based on like a whole host of factors. So it's based on what symptoms patients have, what does the tumor look like, what's the current treatment plan if they're actually in treatment. We use chemotherapy, endocrine therapy, targeted therapy, bone strengthening medications, radiation therapy. So there's a lot out there. And I think the driving thing is that we're trying to alleviate symptoms without causing severe or intolerable side effects. We want to prolong life and length of life, of course, but also quality of life, and ensure that each patient is benefiting from the treatment that we're giving them.